Hi guys. So today we are going to do a competency on modified texture diets. My name is Brandy Matus and I'm the Director of Food Nutrition at Medical City Denton. And our competency today should take less than 15 minutes. So let's start with our mission and patient promise. Say it with me. Above all else, I'm committed to the care and improvement of human life. And our promise, I am committed to excellence always, every action, every patient, every time. So let's talk about who needs a textured modified diet. It could be anyone with any kind of chewing or swallowing issue. At the hospital, speech therapists perform swallow evaluations on patients with signs of difficulty chewing and swallowing foods, and they continue to follow them the entire stay. So they'll determine the appropriate food texture and thin liquid and then place the appropriate diet order. Dietitians and physicians and the patients themselves can order and request certain food textures. So a patient can request a modified diet texture if they feel like they're having difficulty chewing. And if that happens while you're in the room, please alert a dietitian or a nurse, and that way they can modify the diet order. So modified texture diets are important because they ensure that a patient can eat safely. So providing patients with the incorrect texture food can put them at harm, can put them in danger for choking and aspirating. And this is a big deal. One time we did have a patient where we accidentally took the wrong tray into the wrong room. And the patient we delivered a regular diet to was supposed to be on thickened liquids, and I think it was a ground. And the patient was confused and just saw that we had placed the tray in front of him, and so he began to eat and drink. And shortly after he aspirated, he started choking and having a hard time catching his breath. And when you aspirate, those foods and liquids go into your lungs. And this particular patient ended up in the ICU for over a week, and we were very, very concerned he wasn't going to make it. So it is a very big deal that we deliver the right tray to the right patient, and that we double and triple check the tray tickets from the diet clerk in all the way to the hospitality person who is delivering the tray. So that ticket should be checked multiple times before it's delivered to the actual patient. So when in doubt, ask a dietitian, ask a speech therapist, ask the nurse. It's patient safety is number one. Here are just a few causes of chewing and swallowing difficulties: missing teeth, lack of dentures, tooth pain, confusion, surgery of the face or mouth, stroke, respiratory distress, weakness, confusion, pain when swallowing, oral or esophageal surgery or impairment, spinal neck surgery, wearing of a neck brace, or even a brain tumor. So here are the different kinds of food texture that you'll see: regular, chopped, ground, and pureed. And we're going to talk about each one. So starting with pureed, which is one of the most severe, these foods must be completely blenderized and smoothed, so no lumps in it. Some examples are pureed meats and eggs, vegetables, mashed potatoes, cream soups, puddings, yogurts, cream of wheat, ice cream, all liquids, gelatin, and lemon ice. And you will see that our pureed foods are by Hormel, and they're molded to kind of look like the food that it is. You'll see an asterisk by liquids or any items that can melt to be a liquid, and that's just a flag to let you know that if a patient happens to be on a modified diet, they could also be on a modified liquid as well. So if they're just straight on a pureed diet, then liquids are okay. But if there's a liquid modification, then these liquids would not be okay. A ground diet, also known as minced moist, these are foods that are moist and soft in texture, and they easily form a bolus in your mouth. Someone on a minced moist ground diet can have any foods from the pureed diet list. All foods from meats to vegetables on are ground. They can have oatmeal, mac and cheese. On our particular ground diet, we only offer pureed fruits. Again, they can have soups and all liquids if they're allowed to have thin liquids. Typically on this diet, we do not offer fresh fruits or vegetables, so it is either canned or pureed, and all the meats and potatoes should be served with gravy or sauce, and that just helps moisten the food and help it go down. So the next diet is chopped, also known as bite-sized soft. So foods are chopped into bite-sized soft pieces. And again, some examples are they can have any food choices from pureed and ground diets. Meat should always be chopped. Again, fruits and vegetables cannot be fresh, so they need to be frozen or canned and chopped. They can have potatoes as long as it has no skin. They can have soft breads and all soups. Desserts are fine as long as there are no seeds, dried fruit, or nuts in it. And again, we have to double check and make sure they're allowed thin liquids, because if they are on a thickened liquid diet along with chopped diet, then soups would only be allowed with thickener packets, but we'll talk about that here in a minute. I just wanted to highlight our special services in Computrition. We individualize patients' diets because a speech therapist is typically following these patients. They're assessing them multiple times, and so there could be even modifications within the textured modification diets, depending on how well the patient is doing with some foods over others. So you could easily see that breads are okay, and they could be on a pureed diet, but they can manage bread. Or let's say they really just forgot their dentures at home because they came by ambulance, and they can handle regular texture foods, but really need maybe ground meats. And so you can see that this is a place that we can add special things to the ticket to communicate to the kitchen what should be on the ticket. And then regular textured food is just that. It's regular consistencies, but you still need to double check and make sure the patient is allowed to have thin liquids. So let's talk about liquids. So some patients have difficulty swallowing liquids, and sometimes thin liquids can choke them up. So there are different levels of thicknesses that a patient may be able to tolerate. And this is something that, again, the speech therapist would designate and put in the diet order. So the mildest form is nectar thick, moderate to medium is honey thick, and then pudding is berry thick. So if a patient requires thickened liquids, all liquids must be pre-thickened or thickened by the nurse before serving the patient. We have a lot of pre-thickened products already that we can put on the tray, but if there are items such as soups, for example, that aren't thickened in the kitchen, we send up thickener packets so the nurse can pre-thicken it before it actually gets delivered to the patient. So any modified textured diet or not that has a thickened liquid diet order, those trays have to be delivered directly to the nurse so that they can thicken it. So I won't go over all the different packet combinations. We do have a chart in the diet office and also at Trayline that you can reference, so you know exactly how many thickener packets and what kind of packet to put on the patient tray. So what foods are considered liquids? Obviously all beverages, all the oral nutrition supplements like Ensure, Glycerina, Nepro, Muscle Milk, all soups, ice cream, lemon ice, gelatin, juice in the fruit cups, milk and cereal, puddings, and yogurts. And it's obvious, you know, anything that you drink, but the things like starting from the list, ice cream and below, can get a little tricky. But these are all things that over time can turn into thin liquids and be an issue. So here are some foods that we never allow on a thick and liquid diet. And mixed fruit cups with juices, ice cream, gelatin, lemon ice, and ice. You know, those are all things that can melt and turn into thin liquids when they're in the melted state. No mixed consistencies may be something that pops up that you see on a tray ticket. And this means any foods that are composed of solids and liquids together, such as mixed fruit cup, there's the juice and the fruit chunks, cereal with milk, and soup that has chunks in it, like potato soup sometimes has that, or broccoli soup. Oral nutritional supplements, just FYI, it's good to know that they're always considered nectar thick. Soups must always be sent with a thickener packet. And as a good rule of thumb, you'll see this a lot from our speech therapists, absolutely no straws are on this diet order. A lot of times, if a straw is placed in on the tray, of course, the patient will use it and they'll drink the liquids too fast, causing them to choke. Again, just to reinforce about tray delivery, at the time of delivery, if a patient on a thickened liquid diet has thin liquids on the tray, we need to make sure that there are thickener packets on the tray and that we deliver that tray directly to the nurse so they can thicken the foods and then deliver it to the patient. Just a tip, if you work the diet clerk position and you're checking a tray line, I always recommend highlighting the textured diets and any modification to liquids on the tray ticket so these modifications are brought to your attention when you're in the moment on the tray line. All right, so that concludes today's competency. If you have any questions at all about modified textured diets and thickened liquids, please don't hesitate to ask. You can ask myself or any of the registered dietitians. So what's next? There will be a QR code or link available to you. I will send that out in GroupMe, and you will have a certain period of time to complete the assessment form, and we'll get you checked off on this competency. Thank you.